Welcome to Conversations in Integrated Medicine, and today I'm going to talk about weight control and how it may be affected by toxicity of the body or toxicant exposure. There are many people that have subscribed to the notion that detoxification is an important aspect of anybody in the process of losing weight. So we need to examine the circumstances and see what the background to this whole area is. These conversations are sponsored by Natural Clinician and the Holt Institute of Medicine. And if anybody's interested in further information, they can go to www.hiom.org. The notion of body cleansing has been around from time immemorial. There's no doubt that certain traditional medical systems are completely based on the idea of body cleansing almost, together with spirituality and other aspects of general wellness promotion. Perhaps the best example is Ayurveda, where cleansing is a routine process in the promotion of wellness. In fact, in modern naturopathic medical practice, almost all naturopaths start with balancing digestive function and attempts to cleanse the body. Despite this frenetic activity in detoxification and body cleansing, this is an area that's still seeking a clear evidence base for its application in clinical practice. And in fact, this notion of body cleansing may be rejected to some degree by many allopathic physicians. But we have some things to learn from recent events, and perhaps the pivotal event was the exposure of many rescue workers and many citizens in Lower Manhattan, New York, to the catastrophic events of 9/11, where the collapse of the World Trade Center sent an enormous amount of toxicants into the environment, ranging from metals to organochemicals, asbestos, all sorts of minerals, and obviously toxic smoke, PCBs, you name it. There were so many different types of toxicants released into the atmosphere. And obviously the focus group here were the rescue workers, firemen, policemen, volunteers who worked initially during the time at which toxicant exposure was maximum. And I've been working with the New York detox program, and there has been an evolution of toxicity seen as a consequence with many diseases following the 9/11 exposure in many of these rescue workers. And many of them now have been treated, more than 900, by sauna therapy combined with vitamin therapy and oils and exercise and lifestyle recommendations as part of a program to attempt to cleanse the rescue workers of the exposure to these chemicals. Now, I can't go into the disease profile exactly, but many of these rescue workers clearly developed pulmonary disease, they developed skin disease, gastrointestinal upset, and disorders as a consequence of the physical and mental stress of the event, sleeplessness. But one thing that did come out of this, many of these individuals actually had accelerated weight gain. So what's that all about? Well, there have been hypotheses proposed that when it comes to organochemicals, certainly organophosphates and perhaps PCBs, these organochemicals tend to concentrate in fat tissue. And when they get to fatty tissue, there's a body of science that indicates they alter fat metabolism. And what was seen in some of the 9/11 rescue workers was accelerated weight gain and movement towards a condition rather like metabolic syndrome in an accelerated manner. So we're now starting to put together the notion of toxicant exposure, especially organochemicals, together with disordered weight control. Now, when one looks at organophosphates or organic chemicals, herbicides and pesticides, one can see historically they were often not developed for those reasons. Some of them were actually developed to be growth promoters, to accelerate weight gain in animals. So it's not surprising that exposure to these chemicals may cause alterations in weight control. Now the question is, if these chemicals are taken in, where do they go? Well, they go to fatty deposits, and they certainly go to visceral deposits in the abdomen. And in fact, this has led to the hypothesis that I've made that really the pot belly is almost a useless new kind of endocrine organ that has toxicants, altered metabolism, and in fact fatty tissue elaborates inflammatory mediators and hormones in some circumstances. So we can see this all fitting together. How easy are these organic chemicals to be removed from the body? How can we do this? Well, the answer is it's very difficult, but with the sauna therapies, which lasted on average about 33 days, there were some indications that in fact things like PCBs were eliminated. Not completely, but to a certain degree. So people are talking about the idea of how do we restore the body by cleansing. And of course the idea of cleansing really involves the promotion of excretory or detoxification mechanisms that the body has to eliminate poisons and toxins. And of course we look at several areas of the body in this regard, most notably the liver, which is not only a chemical synthetic factory for the body, it's also the principal organ of detoxification. So helping the liver by promoting its action with things like silymarin or milk thistle seems to be a very important aspect of detoxification. Obviously anything that can help eliminate the toxins from the gastrointestinal tract may be valuable. And we've seen the emergence now of programs using colon cleansing with dietary supplements, not with harsh purgatives, but with complex colon cleansing formulas that really are somewhat based on the use of traditional cleansing herbs described in herbal medicine, together with Ayurvedic preparations and simple water-holding substances that will induce free flow, exodus of stool from the colon. Some integrative physicians have opted to do intensive colon hydrotherapy, and with some indication that perhaps there is an ability to remove certain toxicants, most notably heavy metals. Now in fact heavy metals of certain types may in fact also have an influence on weight control. Obviously promoting urinary excretion of any toxicant is important, and there are certain diuretic herbs out there, most notably dandelion. And then not to forget the skin as an organ of detoxification or excretion, and that's really where sauna therapy comes in, and to some degree exercise to induce sweating and elimination of chemicals in the sweat. And finally, we don't need to really forget the lungs. Volatile chemicals are expired, and there are ways obviously of using exercise and breathing exercise to help manage inhaled intoxicants. So the idea that people losing weight should detoxify seems to be increasingly predicated on an evidence base. But when people lose weight, they see some great things happening. They see a decrease in inflammation, they see the elimination of toxins, and actually in fact they can feel the effects of toxicant exposure if they are released from fatty stores while individuals are losing weight. So it seems increasingly that the idea of body cleansing is a very important component of weight control and should be considered by integrative medical practitioners, especially if there is evidence or history or laboratory testing suggesting toxicant exposure. Thank you for listening to this module.